My name is Claudia Reardon, and I am really excited to be heading up our residency program's quality improvement curriculum. What is quality improvement, you ask? QI, as we call it, really involves taking a systematic, structured look at one's clinical practice or any given population of patients, looking for areas where care can be improved, and then using any of a number of QI tools, such as plan, do, check, act cycles or fishbone diagrams, to try to improve the quality of care that you're able to offer to that population of patients. Why is our QI curriculum special? Well, I'm biased. I do think it is special, and I think it really is a testament to the time and attention and resources that our department is willing to put into our quality improvement curriculum. We're fortunate to have a number of really talented, expert faculty members involved in teaching our residents in our QI rotation and our QI seminar. And I think it's really because of the time and attention that those faculty members put into it that we were actually fortunate to be honored with the 2015 American College of Psychiatrists Award for Creativity in Psychiatric Education for this curriculum. Our curriculum involves, for the most part, our third-year residents who do the bulk of our QI work, spending a chunk of their time throughout their third year of residency working on quality improvement projects. Each of them works with one of their classmates and their very own dedicated QI project supervisor to work on a project that really gets at improving some aspect of the clinical care with which they're involved. I think it's noteworthy that our residents get protected time to do their QI projects, so they have time over the course of that whole year to really spend studying the problem that they're trying to improve and really trying to develop sustainable solutions to that problem. I think in a lot of places, through no fault of their own, QI, while a requirement for residency programs, is something that can be somewhat of an afterthought and something that residents unfortunately may need to do on their own time. But because of the resources that our department is willing and has been able to offer, our residents do get that protected time during the workday, during their third year, to work on these projects. And it's wonderful and something we're really lucky to have here. So why does QI matter for the practicing psychiatrist of the future? Why do we spend all of this time working with our residents on QI? First and foremost, of course, we want our patients to get better, and that's what QI is all about. We want our patients in psychiatry to have more access to care. Access is a huge problem, and that's one aspect that QI can get at as well. From a more pragmatic perspective, the fact is that the healthcare system of the future is going to involve there being incentives for quality care being provided to patients, and this will come in the form of pay for performance. So, I think that physicians, certainly including psychiatrists, are going to be accountable to providing really high quality level care for their patients, and being adept at how to systematically improve the quality of care that we provide is going to be a very important aspect of that. Finally, there's something called maintenance of certification. This is the process by which physicians, including psychiatrists, maintain their board certification status. And maintenance of certification is not like it used to be. In the old days, doctors would get board certified by taking a one-time written test, and that's it. They would never have to do anything again. Now it's quite different, and doctors actually need to do routine quality improvement projects in order to maintain their board certification status. And we feel here, what better time and place to learn how to do that, how to do QI projects, than in residency, as opposed to waiting until you're out in practice and then trying to figure it out on your own. Our residents have done a number of really interesting, meaningful, sustainable QI projects, and I could spend the next hour describing all of them to you, but just to give you a taste of some of the really interesting ones that we've had in recent years, these include looking at ways that we can increase the rates with which we offer interventions related to diet and exercise and mindfulness for our patients. And those are things that really we try to incorporate in all the work we do here. We're not just about medication management. We've also had a project looking at ways with which we can increase the rate with which we ask patients about smoking and with which we recommend smoking cessation. And I think this is a really big deal because we know, of course, that many of our patients in psychiatry do smoke, but unfortunately, we as psychiatrists generally do a woefully inadequate job of asking our patients about that and recommending that they quit. We also had a QI project in recent years that has since been published in the medical literature, in which the resident involved looked at decreasing the wait time between the time of placement of a request for a consult to the UW Emergency Department for psychiatric services and the time that the patient was actually seen by psychiatry. In sum, then, I think that we here at the UW Psychiatry Residency Program work really hard to try to stay on the cutting edge of psychiatry, and that translates into our working really hard to try to prepare our residents for the practice of 21st century psychiatry, and we think that quality improvement is a really important part of that.